One of the things that Health Canada is considering is a special request from Pfizer. It wants to cut the number of vials they deliver. John Northcott in to explain all of this. It's such an interesting story. Doesn't mean a reduction in the number of doses, just the number of vials, and this all hinges on the syringe.
Indeed, yes, the low dead volume syringes. More on that in a moment. But first, let's look at the way this works. Was it 5? Or could it be 6? We know that those vials, life-saving vials, slated to provide 5 doses. Now remember, the drug companies, all of them, contracted per doses, not per vial. Now, pointing to what may be some excess capacity in there, and this request by Pfizer has been acquiesced to by both the United States and Europe earlier, in fact, quite early in January already. But the argument being that there is, in fact, in each of these, some excess capacity. So change the label, they would argue, accurately, to say that there are, in fact, 6 doses in each of those vials. So the shipments keep on coming, the vials keep on coming, but the number of doses per vial arguably is more. They're able to then fulfill and to get, which of course, as we've seen, as they down tools to retool, and they're a plant in Europe with the pressure around the world. The hope is that they might be able to get some more dosage out of each vials, more needles in arms, and still fulfill their contracts. All of this, though, as I say, is around, much of it around, rather, a needle that does not require as much in the end of it, and that is where that low dosage vial that goes to waste won't go to waste as they go forward. Heather.
You know, it's all about getting the materials, isn't it, John? Are there going to be enough of these special kind of syringes?
Well, that's the big question at this point, Heather, and we'll show you a picture of those syringes and try to walk you through it, because honestly, when you get into journalism, you don't think you're going to be explaining the minutiae of how many angels can dance on the head of a needle, but effectively that's what we're seeing here. On top, a more common use needle there, and you can see that red portion is what is effectively left over in the dose. The low dosage, again, the low dead volume syringe, there you can see on the bottom just a little bit. So in other words, they are essentially not wasting any going forward, and more efficient use because of the effectiveness of the syringe. There is demand, of course, not only for vaccines, but for this type of syringe around the world. Let's listen to Procurement Minister Nita Anand.
We have procured supplies for all the provinces and territories, from needles, swabs, syringes. I think it's important just to have some understanding of the global environment in which we're all operating, and that the world has never seen a vaccination campaign like this before.
There are tens of millions of that particular type of syringe on order, but exactly when they'll arrive and where they come from and how much it all costs so far, we don't know.